This meeting is being recorded, and we will start our meeting today by thanking Kenya Psychiatric Association and the Clinical Psychologists Association of Kenya, who have collaborated with us as Kenya Medical Association to start out this program. We sat down with Kenya Psychiatric Association and felt health workers have been left out in all the planning in terms of mental health, health and wellness, and we are at the front line, or we are basically assisting those who are at the front line, and we really needed to ensure that we take care of your health and well-being and ensure we don't end up with suicide cases like we ended up seeing when we had the last strike within Kenya, where lots of people felt very distressed, moral injury had set in, and this has been a trend going on. So we felt this was not something we wanted to do only confined to doctors, but we opened it out to all health workers. So within our audience, we do have even nurses, we do have clinical officers, and even allied workers and our support staff. Do not forget them when you think about anxiety. So today we start off with Clinical Psychologists Association of Kenya. They are a rare group that deals with us in a very special way and is a very key group when it comes to health and well-being of everyone in the society. And you will meet them in a few minutes. We have Liz Kahemba, who's the chair of the association. We also have with us the Kenya Psychiatric Association CPD coordinator, Dr. Catherine Gitao, and the assistant, who's Dr. David. He will introduce himself shortly. Kindly, I would ask they unmute and do a quick round of introduction. Then we go on to the presentation shortly. Dr. Oas will be moderating for us. Dr. Somba will join us as we move along. He's the chair of the Physician Wellness Program, which is under Kenya Medical Association. Thank you. So we go, David, I hope you're with us. We can start with Catherine and David. Dr. Gitao.
Hello, everyone. Dr. Gitao here. Karibuni.
Dr. Catherine Gitao. We have two Gitaos within. I think she's on her way home and she'll be joining us later. She'll also help with closing this meeting when we are ending today. So we have Dr. Oas with us. Dr. Oas, Josephine, do introduce yourself before we move on to our clinical psychologist team. I think she's having challenges unmuting. We can start off, Dr. Liz. You can do a small introduction of the Kenya Psychologist Association.
Oh, okay. My name is Liz Kahemba. I'm a clinical psychologist and current chair of Clinical Psychologists Association of Kenya. Clinical Psychologists Association of Kenya is still quite new, and we have quite a number of health workers who are part of our team, but our core team, of course, is the clinical psychologists. What we have been doing so far during this period is just basically providing support, especially voluntary support to the quarantine centers and also to some healthcare workers, but not to a great extent. So this is quite welcome for us. We are clinical, so we work in the clinical setting, and this really is what we would like to do to provide our support. Yeah.
Thank you. Dr. Yvonne?
Hi, everyone.
Hi.
I'm Yvonne. I'm a clinical psychologist. I'm working with different hospitals and currently a lecturer at University of Nairobi with the Department of Psychology. Thank you.
Thank you. So we will start off today with the presentation on anxiety. I believe everyone is going through a very anxious time, either being at the front line or you are basically seeing that essential services are not being delivered, or the numerous information that we are receiving all over. In addition, economic hard times are facing us. So anxiety has set in amongst many health workers and the general population at large. We also have issues of schools. Most of our children are at home. We do not know what next. So this has led to quite a distressing time. So generally, we'll start with defining anxiety. Yvonne Orlando will do the introduction in terms of defining anxiety, and then we move on to Lisa Hemba, and we'll take questions at the end. Please keep jotting down your questions in the chat so that we can take them at the very end and have a great presentation. So Yvonne, you can take us through. Remember,
okay, can you see my screen?
Yes, we can.
Yes.
Okay. So I'll just look at an overview. So for this first part, I'll talk about anxiety in general. When you're looking at anxiety, we know everyone goes through it. It's a normal human experience. Basically, what comes to mind first is unease, some sort of worry, some sort of fear. And it brings both the emotional aspect and the physical part of it. You end up feeling worried, you'll end up feeling nervous. But when you're focusing on fear, we are looking at this is an emotional reaction to something that we know very well, but it's more of an external threat or danger. And at that time, you're not very sure maybe how to go about it. I'll also be looking at symptoms of anxiety, and this is in general, not specifically to the health workers. The worry comes in majorly when anxiety becomes pathological. And this is when it will become abnormally severe, it becomes pervasive, it is persistent, irrational, in the sense all of us are wondering, why are you actually concerned? It is inappropriate, and therefore it is disabling. But with optimum levels, it is very beneficial because then it gives you a reason to do something better or even work harder. We worry about it when it is in excess because then it hampers somebody's performance. We look at two main areas of symptoms, and here we'll focus on the physical and psychological symptoms. So I've made a list of them, but since people are different, people experience anxiety differently. As I'm going through the list, you could look and see which one applies to you and maybe which one does not apply to you. The first one is the physical symptoms. So there people will have nausea, others will have abdominal distress. So someone will keep complaining about their stomach. They are very uncomfortable. Others have headaches. There are those who are having muscle tension. Massage doesn't seem to be working very well. There are those who are feeling numb or some tingling, the pins and needles. There are those who are feeling lightheaded or dizzy, especially if they see TS Mutahi just standing there about to give the daily brief, and they just feel like it is finished. There are those who have palpitations. Others are sweating a lot or hot flashes. And for those who are menopausal, not the normal one. Then there's chest pain, shortness of breath, and of course, hyperventilation for others. Others have raised blood pressure, others it is lowered. There are those who are having problems with diarrhea and constipation. If you hear there's a new case being reported, diarrhea. There are those who are having churning in their stomach all the time, so it's very uncomfortable. We've had cases of menstrual disturbances, sexual dysfunction for both. There are women who the man should not come near them because things are bad. The men also worried, and especially with the social distancing, you're wondering, yes, you're my partner, but my chief is the one who has the virus. Loss of appetite, the dry mouth, or difficulty swallowing for some, and fatigue. I've also highlighted substance misuse because there are people who right now, the anxiety is presenting an increase in the substance they're using. So there are those who are drinking a lot, particularly alcohol. There are those who are smoking a lot because at least the cigarettes are still being sold. They're not as closed off as the bars. People are excessively using the substances. And we've already started having cases of relapse for those who had already been managed. The other symptoms in general are the psychological symptoms. For here, we are looking at people who are always feeling tense. There are those who are nervous. There are those who are feeling on edge. There are those who are feeling like, there's just this sense of doom and gloom, fear of the worst. Then there are those who are feeling like the world is speeding up or slowing down. So you'll find people starting to ask, why didn't I do this last year? Why didn't I get married then? Why didn't I get children back then? Because they are worried they might not make it. There are people who feel others are watching them. They can actually see that they're anxious. Others are not able to control their thoughts. I've had clients who are telling me, I'm actually they're calling them committee meetings. They can't sit still. Things are just going and going. They're just thinking about everything at the same time. Others present anxiety by focusing on negative experiences. So if they went somewhere, met people, but they forgot to wash their hands or sanitize, they keep asking, do you think I might have contracted the virus? Do I need to wash my hands? Then of course, difficulty in concentrating. There's restlessness. There are those who are not sleeping well, particularly if you know somebody that has been tested and they've been found to be positive for the virus. There is hypervigilance, and there are those who are very irritable. These are some of the general symptoms that some of you might be experiencing, or you've heard of other people who are also experiencing the same. Now, maybe I'll hand over to Dr. Liz Kaemba to take us through symptoms, particularly for the healthcare workers. Back to you, Chair. You have muted.
Okay, yeah, there I am. Sorry. So Yvonne has just taken us through anxiety among the general population. I think Dr. Yvonne has done a very good job. But these, of course, are also being experienced by healthcare workers, including those who are not in the immediate front line. We do know that things have changed so drastically and so fast, more than we have ever seen before, and people really don't know how to cope. And from just my deduction, a lot of us are actually going through grief, or what we call anticipatory grief, where we have seen a lot of loss. And we've gone through the processes of denial, of anger, bargaining, depression, and some of us have reached the point of acceptance. But as we cycle through these processes, we realize that anxiety remains the constant. Whether you are in the are still at the point of denial, where you're saying, oh no, this can't get bad in Kenya, this can't be that bad. If I wash my hands, then everything should be fine. We realize there's still that underlying anxiety among all of us. Now, Yvonne has also said that anxiety is a normal reaction to uncertainty and things that may harm us. And we know that these are uncertain times. We know that all of us are worried that this might actually harm us, or we may become positive for COVID, or our families or our friends. So nearly all of us are at the stage of anxiety. But what about the healthcare workers? What is unique about the healthcare workers? Now, healthcare workers are also coping with these issues that all the rest of the population is coping with. They're anxious about themselves, they're anxious about their families. But the difference is that they face a much greater risk of exposure, unlike anybody else. They are currently practicing in an environment that is unlike anything they have ever practiced in before. You know, it's very unfamiliar. They are also faced with a lot of moral dilemmas. You know, when things become really thick, then there are these decisions that have to be made. So what happens? How do they make those decisions? Yeah. And we know that for a lot of healthcare workers who are working in the hospitals, even in the quarantine centers, the workloads are currently extreme. So whether you're working as a lab tech, or you're working in the pharmacy, or you're working as a nurse, we recognize that the workloads are actually quite extreme right now. So just trying to find out what are the main causes of anxiety for the healthcare workers specifically. Healthcare workers are afraid and are worried about exposure at work and then carrying it home. You know, if it was just you and you're exposed and you're working, maybe it's not too bad, but the fear of going back home to your house and giving it to your child or your family, the rest of your family, is a great cause of anxiety. Another thing is access to proper PPE. Like we have seen in the rest of the world, Kenya is no exception. You know, we have difficulties with getting the proper and correct PPE. So that also means that there's a higher risk of exposure. Worry about support from our employers, you know. So if you are infected, what happens? Does the employer then help with your family? Does the employer help with your family needs? Worried or anxious about not having rapid access to testing and treatment if you develop symptoms. What happens to you as a healthcare worker? You have been on the front line, you have seen how patients are being treated or are being handled. And when you look at that situation, you probably don't expect or don't want to see yourself in that kind of situation. So that is a real worry. Being able to provide competent care if you're deployed to a new area. When we get overwhelmed, for example, the ICU nurses, then of course we will take a regular nurse and just put them in the ICU. Are they conversant with ICU protocol? You know, so that is also a major area of anxiety. So for what I did is just try and divide this anxiety into three main areas, where there's the individual anxiety, for one. In individual anxiety, you feel, am I prepared for this situation. A lot of us are not. So we are just winging it, you know, we are just doing the best that we can because we did not have any preparedness training. Another thing is training. Did anybody train us, or is anybody training us on how to handle the situation? So as long as you're winging it, you don't know sometimes whether you're doing the right thing or the wrong thing. And then our healthcare workers, as we said, they're just human beings like everybody else. So some of them have pre-existing conditions, physical conditions, yeah, that make them susceptible to, or make them at risk for developing, when exposed, for developing COVID-19. Another thing, access to care. Are we getting this access? Are we, for example, if you cannot go home for one reason or another, are we receiving the good accommodations, food, transport, etc.? And then for us as psychologists, one of our main focus is mental health predispositions. We know that many people, many staff in healthcare also suffer mental health issues. For example, we have anxiety, we have depression. If you look at your family history, does that predispose you to having a mental health issue during this time? And then also burnout, yeah? If you're working hours and hours, you're working double shifts, what happens? Yeah, what happens to you? You will get burnt out, and that in itself is a problem. So the second thing is institutional causes of anxiety. Institutional just means what are our hospitals giving us, or what are the organizations providing? Is PPE being provided? That will be a cause of anxiety. Again, preparedness. What is the institution doing? Is it providing the correct training? Is it encouraging the correct interactions? What is happening? How is the management of the institution you work with? Is training provided regularly, or is it just one training and then you're left to wing it on your own? So our healthcare workers, for example, updated and provided with frequent information. So that also is a problem and is a big cause of anxiety. In the third thing is our community. Yeah, we know very well, as you go out there as a healthcare worker, somebody will ask you, so what are you guys doing? Have you guys found a cure? You know, and maybe you are not really in that area of finding a cure. Have we educated our community? Have we educated them to the extent that they do what is right to prevent or to protect themselves? But the worst thing that we are finding as healthcare workers, today I was talking to a paramedic who developed a cough, and she was really, really stigmatized by her employer, to her family, who made her like stay in a totally different place, yet she had been tested, yet she was not, she did not have COVID, but she was in tears for the extent of the stay that she had to wait until her cough went. So there's a lot of stigma, and people, including close family and colleagues even, are very afraid that they will try as much as possible to stay away from you. So all these issues are causes of anxiety for many of us as healthcare workers, especially those who are working in the front line. Yeah. So from here, I suppose we also need to talk about then what do we do as healthcare workers? What are the interventions that can be provided? And I'll take the floor back to Yvonne, and then I will also say talk about a few interventions. Yvonne?
Thank you, Dr. Liz. I'll start by looking maybe at just the general strategies that we have. Somebody mentioned that it was not very clear. I hope it is more clearer now. Can you hear me?
Put it on slide. Yeah, thank you.
Okay. So just looking at the general coping strategies, The first one, we're looking at, need to focus on things that are in our control. Right now, worrying about, do we have the vaccine? It's actually not within our control. So simple things like washing of our hands, staying home for those who can, and of course, the social or physical distancing. The other thing I think we need to highlight is it's more of a physical distancing. When you're talking of the social distancing, it doesn't mean that you disconnect from people. Families are actually having meetings using Zoom. You can find alternatives to talk to people and to get support. You can call people. You can share, like right now, if you look online, there's a lot of people are baking, people are trying new things that they've not done before. You could actually start a club, a movie club. Like there's one we have where every week you're sharing what are the latest series that we can watch, things that can actually distract us from the rising cases. You could also schedule a workout together with some of your friends over video chat. Zumba is available online. There are some exercises that are available on YouTube. You can actually call friends so that you support each other. The second one is acknowledge your feelings. It is difficult. I mean, what people are going through right now, particularly the healthcare workers, it is difficult. And it is okay for you to feel anxious. It is okay for you to be fearful for yourself and for your family. Also, allow yourself time to notice and express what you're feeling. There are people who feel that if I say I am scared or I'm anxious, then it's a weakness. Sometimes when you keep it inside, that's when it actually becomes more problematic. Journal it down, you know, write about that fear, keep a diary, talk to others. Like I am happy KMA, KPA, CPAC will soon be having a toll-free line. Feel free to call us and we will walk through this with you. You can be able to vent. You can be able to share maybe the worst scenario you experienced at work. You can channel your emotions by drawing. For those who are good in drawing, you can just make something. And you can listen to music. There are people who enjoy music. So that could be good for them. The third one is maintain your day-to-day activities and routines as much as possible. Simply go back to basics. If you can eat healthy, try. That you can control. It is exercising that you can control. With the physical exercise, there are places where you can't walk far, but you can walk within the estate. You can walk within your compound. Exercising within the home. There are stretches you can do even in a small space. Try and get enough sleep because then it calms your mind and it reduces the anxiety. And do things you enjoy. If it is just that eating, enjoy. For some of our family members who are under quarantine, they can actually still use some of these exercises. We cannot pretend that it is not scary. Some people right now are thinking about what next? Can I really do this? They're scared. And you're saying, yes, that is happening, but there are things you can do. Some of the healthcare workers and even some psychologists, they're still students, but they're out there trying to support. So in their free time, you're saying, try to just continue learning, do something else to distract you. Read a book, listen to some podcasts, or start out a new hobby that somebody else has been doing and you've not been able to try it before. The fourth coping strategy is to keep things in perspective. Sometimes when you worry too much about what if, you become overwhelmed. So some of the questions that you can use to stop yourself from catastrophizing. One, you could find out, is this within my control? So that if it is, then yes, go ahead and do it. If it is not, what else can be done about it? We, in the AA forum and also in our rehabilitation programs, we really focus on understanding the serenity prayer, because serenity prayer helps you understand, is it a matter of wisdom or a matter of courage? Do I have the courage to change this? Do I have the wisdom to know that this, I cannot do anything about it, so that you accept it? Secondly, are you overestimating the likelihood of the worst case scenario? Did you touch somebody by mistake? Are you worried that, oh my goodness, I did not sanitize, I did not wash my hands, or am I already infected? Are you imagining the worst case scenario? What other strategies have you used before? Because you've had anxieties before, even if it was just during an exam, if it was in a relationship, if it was any simple thing that might have caused you a challenge. How did you cope with it then? Some of those basic coping skills are the ones that will help us at this time. Finally, under the fourth coping strategy, the question is, what is the small positive thing that you can do to make yourself feel better? Sometimes we don't need the huge ones. We just need the simple ones. The step-by-step ones are the ones that will be able to get us there in the end. Fourth, we are saying focus on the accurate information. We are lucky CS Kagwe is always bringing for us what we have here, so that we do not have to go and worry about it from the Facebook and other online medias. For some people, they need to set limits around news and social media. There are people who are looking for information. I know the US said that China lied, and therefore they are worried. Or it was estimated that by end of this will be at 10,000. And there are people who are already hoarding, and they're very scared. We need to focus on, what can I control? If watching news or listening to social media is causing me anxiety, but you still need to have that information, just schedule a specific time to get that news, but ensure it is accurate information. The sixth one, we are saying that yes, it is a difficult time. It is an anxiety-causing time. So plan for what you can. For those who are worried about their children, what can you do about it? You can get for them those online studies that are going on. Most of them are for free. You can interact with other mothers. For those who are on quarantine, you can still communicate if possible. If you're worried, write what exactly is my specific worry about this COVID. Am I just worried because everyone is worried, or am I worried because of a particular reason? Once you narrow what your worries are, then you can focus on what to do for it. Then make a list of those possible solutions. What can you do about what you're worried about? Focus on the concrete things that you can use to solve the problems. Not things that are vague or you're visualizing, things that you can do right now. They'll actually encourage you more, they will ground you, and you'll feel like you're in control of your situation. Finally, it is difficult, but remember to be kind to yourself. You are, like for the healthcare workers, you're the ones who are there, especially for the ones who are in the isolation centers, the ones who are at the quarantine sites. Be kind to yourself. This is the time that most people are going to suffer from anxiety, and even more people are going to suffer from it later, together with depression. So you're not alone in your struggles. Reach out, talk to people, then get out as much as possible. Just like when people are in the wards and sometimes they're encouraged to leave, go sit outside in the sun, stretch a bit. As much as we are not sick and some of our family members are also able to walk around, sometimes just go out. You don't have to go far, just go out, let the sun shine on your face. See the color of the sky for that day, then come back inside. Just that change in the air you breathe can be able to relax you. Find ways to exercise. And I keep repeating this because we use it for anxiety, we use it for depression, we use it for different disorders. Exercise, it is very simple. And avoid self-medicating. This forum has so many doctors and so many psychiatrists. Unfortunately, sometimes others self-medicate. Talk to somebody else. Mganga ajigangi. You need someone else to be able to assess you. Others are medicating using alcohol. We are hearing cases of people hiding in farms, coffee plantations, and they're drinking thoroughly. We have had several cases of people hiding in bars, and they're being locked inside and they're drinking. Others are carrying the whole bar to their homes, and they're drinking, and they're like, okay, we are in quarantine, we are drinking. We are staying home, but you're drinking. You might end up causing a problem for yourself after. And finally, take up a relaxation practice. There are different things. We can do deep breathing. Like there's a nice one that they call it the square breathing technique, where you imagine a small square and you breathe in, hold it in, you count to 3 until you've gone on one side. At the end, you exhale. You breathe in again, imagine you've crossed to the end, count to 3, exhale. You do that until you've completed the square. It is very simple and you can do it anytime. You could do meditation. You could do yoga. Massage for those who are blessed enough to have partners. All of these are some of the coping strategies, very simple, that you could encourage your family members to try, and you could also try them by yourself. Thank you very much. Back to you, Liz.
Thank you, Yvonne. So Yvonne has taken us through quite a number of coping skills and strategies that we can use. I will add a few things, but not very much. One of the things I would say is learn how to build resilience, because at this point, we really need to be resilient. We really need to add on to the resilience that we have. So we need to also review our coping mechanisms. This will help us to build more resilience. For example, what do you do when you feel anxious? Do you sing? Do you cry? Which is, all that is okay, you know. Do you talk to other people? What do you do? Add on to those things that ask other people, how do you cope? And if it works for you, then you can add on to build further resilience. At our hospitals or our institutions where we work, can we ask also for more capacity building? Because when we know what to do, we feel less anxious. For example, what happens when a COVID-19 patient is brought in? What is the protocol? 1, 2, 3, we do this, then that. Other than just thinking about patients, also we want to ask about ourselves, what happens if I turn positive? Yeah, so that we have this preparedness. Preparedness will help us feel less anxious because we know exactly what to do, basically. Yeah, so we need our institutions also we need to request our institutions to provide us with the most basic education or training about how to cope with this situation, and a little bit of advanced training, and to have this repeated over and over, at least every week, so that it becomes a part of us, and so that it also works to decrease our anxiety. We need also to build capacity to deal with the problem, with this issue. That includes increasing our knowledge about COVID, so that as healthcare workers, we know what to sift out, what is just drama and what is fact, yeah? And this will also help us to find different ways of coping. We need to to encourage you healthcare workers and us also as healthcare workers. What has happened in the past is because we are in this sector and it's a very emotional sector in the best of times, we have become very self-reliant. We rarely seek help, you know. So encourage not only others, but also yourself. When you realize that things are getting a little bit out of control for you, that your emotion appears to be running away with you, that you seek help. And as Yvonne has rightfully said, our team, this team that has invited you today, is also working on creating a hotline where you'll be able to call in and you will be able to get the help that you need, even if it's anonymously. Yeah, there will be psychologists on standby and there will be other people who, and psychiatrists even, yeah? And as Yvonne has said, if you do ultimately need medication, get it from the right channel, the right place, and the right people who can actually do a proper diagnosis and then be able to give you medication instead of self-medicating. Encourage teamwork. Teamwork is really, really important at this time. We realize that there are some moral decisions that will have to be made at some point should our numbers increase. And no healthcare professional should have to make these moral decisions by themselves. So teamwork, working together, relying on each other is very, very important. And also, it decreases the level of anxiety that we actually feel. Form groups where you can either learn how to debrief each other or attend debrief sessions that we as psychologists and even other healthcare workers will be able to provide. We will be able to listen to you. We will be able to talk to you. We will be able to help you find solutions to how you're feeling and what you're going through, yeah? Provide support, not only for the patients that you're seeing or the people in the quarantine centers, but also for one another, yeah? Let your colleague know that you are there for them. Let you know that your colleagues are there for you. And when you feel that you are emotionally affected and you cannot cope or you cannot deal, always try to reach out to your colleagues and they will help. And when you need to, reach out to us. We are here to support you. We are here to make sure that all of us remain mentally healthy and come out on the other side when we are okay. We do know right now, as Yvonne has said, some of the symptoms of anxiety are very, very similar, unfortunately, to the symptoms of COVID. Yeah, nausea, abdominal distress, headaches, palpitations, chest pain and shortness of breath. You can see where this thing is going. And sometimes when you have those symptoms, and if you're like all other healthcare workers, when we were learning about symptoms of various illnesses, we actually thought most of those symptoms applied to us. But just find somebody who you can use as your board, you know, someone who you can talk to and say, I'm feeling like this, I'm feeling like this. What do you think? You know, and find somebody who can also reassure you and who you can reassure when you feel distressed. Remember, it is okay to cry. A lot of us have cried. You know, if you feel that it's too much for you, it's okay to step aside and cry. It is okay to vent. It is okay to feel a bit angry. All these emotions, as long as we can identify them and let them pass through us instead of ignoring them and neglecting them, is good actually for us, yeah? And as Yvonne has said, we can also use these techniques, relaxation techniques, breath work, muscle relaxation, mindfulness, meditation, all those techniques also are there. And I think that then brings to the end of us and talking about anxiety and the interventions for anxiety. We'll take it back to the chair.
Thank you very much, Liz and Yvonne. That was very insightful. I have learned quite a lot. Yes, I've had my anxieties, my fears. I wake up every day and I'm like, I'm going to the front line. Is it today when I'll make a mistake and probably end up getting infected? Is it today's patient will end up turning positive. The minute you collect all those samples and send them out, it's almost a 24, 48 hour of distress. And most people as health workers don't understand what the other colleague is going through. Case example, yes, you've collected samples today. You've got to wait 24 to 48 hours to know the results. You're anxious for the patient. You're anxious for yourself. That did I make a mistake? Could I be infected? If you cough the slightest, anxiety rises way much more, stress, burnout, all those things are going on. And to be able to ascertain, are these things that we are doing, are they the right things? Are we actually in the right path in terms of controlling COVID? So all this is quite stressful, but today we've learned quite a lot. I am glad to be in the midst of psychologists and to get special attention whenever I need. So someone has asked, there are quite a number of questions, and I'll ask also Liz Gitao to help me where we may miss out a few questions. So someone asked, do we have any plans as psychologists association to avail our services to health workers pro bono, or launch an online site to provide telecounseling or advice /info? Yes, this is why we have collaborated as three of us, Kenya Medical Association, Kenya Psychiatric Association, and the Clinical Psychologist Association of Kenya, in order to ensure that we reach out to as many health workers as possible and assist as much as possible. So yes, Liz did answer that. We are trying to look for a toll-free line, which will be up and running in a few weeks. So watch out for that within the KMA website, the Facebook page, and the websites of the other two organizations that we are partnering with. And share amongst yourselves when you get this link, and let a friend be assisted, and be a friend to a friend. Call up someone who you have not had for so many days and hear how they are doing. Liz, next question. Gitao. There is a question on whether Liz and Yvonne will share their slides. Will you be able to share your slides with the team, or will you share the video? We need to seek your permission also.
Killing my arm right now. The amount of body strength you need is just ridiculous.
Well, I don't have slides.
Yvonne is the one who had slides.
Yes.
Yes, there's no problem. You can share the slides.
Okay. We will upload them. There is an interactive site within the KMU website where you can. Sorry, Liz, your.
I am now unmuted.
Yes.
I am seeing a question here. On do you have provision for integrating medical students and other health science students in tackling the anxiety issue? Besides them being affected too, they may come in handy. So I think
Yes.
from KMA, we've been working with Misake and various other associations, and the students actually helping out in terms of creating webinars for themselves. I've seen a couple of webinars from AMSUL and Misake helping out with students, but yes, they are involved, and I think Joy is their patron, so she would know more.
Yes, so we are also involving the residents in psychiatry, and I believe Yvonne, being a lecturer at University of Nairobi, we are also going to be involving the clinical psychologist students. So the students are involved. Mentorship begins with us. We have to be able to teach them how to be prepared when disaster strikes and how to respond to it. So there is a question on CPD. Yes, we'll be providing CPD for the medical doctors. We do have our CPD platform, and this will be shared on your emails. If you can drop your emails on the chat, we will get back to you with CPD points. That came from Janet Moya. Please.
So Joy, I think there's also, I've seen the numerous email addresses. So
Yes.
I think we'll ask our team from KMA to reach out to them. They're going to ask questions on which society they belong to, so that we know who can give the CPD points. But someone will get in touch.
Yeah. Liz, for CPAK, do you do CPD points?
Not yet. We don't do them yet. But although there might be others who might need the points, so who are maybe in other associations also. So we'll ask them. We'll talk to them and see who needs points and who doesn't.
Okay. Thank you very much. I think there's some. Okay.
So the other question was on grief therapy. The role of grief therapy for those who've lost loved ones to COVID.
Mm-hmm.
I think Liz can answer that, the role of grief therapy.
Well, grief therapy is very important so that we avoid having complicated grief in the future. And especially because right now we don't have a long mourning period, we really need to be able to support families that need care. And so as part of the line that will be provided by KMA or by this joint group, and we feel that maybe people can call in, especially, this is specifically, I think, for healthcare workers. Healthcare workers can call in, and they will be supported with whatever therapy that is required, whether it's anxiety, depression, grief. We will be available to support as clinical psychologists and psychiatrists.
Okay, and maybe also to just add, we had also talked about supporting families of the healthcare workers. For those family members, you are also finding it difficult seeing that the families are on the front line. So yes, your families will also be supported. Yeah.
So I'm seeing another question about anxiety in children. I think this is a whole new CME on its own. And I think maybe Liz can maybe set up a session for that.
Yes, most definitely. It is a big topic. Briefly you can say children may, during anxiety or when they're exposed to anxiety, may tend to regress. So we might see a bit of wetting, soiling, depending on how young the child is. Some children may tend to withdraw, but what we need to know kind of immediately is that children leech off our emotions. So we need to be careful also how we are presenting, how much anxiety we are showing them. And then that will either ease the anxiety or make it worse. So basically, as you said, it is a whole new CME on its own. But that's the long and short basically of it.
Okay, thank you, Joy. There were no other questions. You can take over the meeting.
Okay, thank you very much. I think this was a very informative meeting, and we look forward to the follow-up meetings that we have. Do watch out for the links that we will share in another few days. That we'll share in another few days, so that you're able to learn more about the mental health issues.
Exactly. That's what I was telling you.
So Cornelius Kibet, we are sorry, we are hearing your conversation. There's someone who's clobbering someone. So I think, Liz, you will need to work with them. So yes, thank you very much for this, Liz and Yvonne. It was quite informative, and we do look forward to the next meetings that we'll have. The next one we will have along with us the Kenya Psychiatric Association, and we will share the topic in good time so that you all learn from what will be shared in that. We look forward to the next meeting. Thanks a lot. And I will log off from there. Thanks, Liz. Thanks. And Liz Irongo, you have been silent. She's part of this team. Next time she must be the one who will be hosting.
Your son is